Hello everybody and welcome to this edition of Virtual Coffee with an OSCE Educator. My name is Sarah Grant. I'm the Managing Director of My Healthcare Recruit and owner of OSCE Accelerator learning programme. I have been joined today by the lovely Beth Vincato. Beth is an OSCE educator. She's been teaching OSCE for the last 5 years at an NHS trust and has literally supported hundreds of international nurses through the OSCE. So she is a wealth of information. So we've invited her on today to talk about administration of inhaled medication. So this is one of the clinical skills in the OSCE exam. It's something that we get questions on our social media channel. So we just wanted to dive into it in a little bit more detail and let you know what you can expect at this station and what you might be presented with. So welcome, Beth. Thank you for joining us. And let's dive straight in. Administration of inhaled medication. What is this station all about?
Okay, so for this station, you're going to have to give the inhaler to a mannequin. You'll have to use the spacer device. So obviously, if you haven't seen that before, have a look at it. The medication you're normally required to give is salbutamol. It's also 2 puffs, and the scenario you have will be community, so it will be like in a clinic or in the doctor's surgery. It will be the patient's first time using it, so you need to educate and explain to them what to do.
Wonderful. And how long on the clock for this station?
It will be 12 minutes.
12 minutes, wonderful. Any documentation to complete at this station?
Yes, so it's just a simple drug chart, so it's quite straightforward.
Okie dokie, to say that you have administered the spacer inhaler. And equipment-wise, what might an international nurse be expected to interact with equipment-wise at this station?
So you'll have a mannequin which will be either sat up in the bed or in the chair. You'll have your inhaler, obviously, and your space chamber. So the space chamber is the same one that we're using for like pediatrics or with people who have poor dexterity and they can't press the inhaler themselves.
Got you. Any reasons for common fails, common mistakes at this station?
So not having correct technique when giving the inhaler to the patient and not explaining it well.
Okie dokie. And so can you talk a little bit more about that technique then? What would be a good technique and what would be a poor technique?
Okay, so there's 2 different techniques you can use for this. So there's one called tidal breathing or there's the multi-breath. So I would recommend picking one of those and just sticking with it to learn it. So the multi-breathing is the more simple one, but if you're already familiar with the other technique, just stick with that. Obviously, you don't want to confuse yourself. So it's up to you which one you do. They are explained on the marking criteria if you're not familiar with them.
Wonderful. And how would you recommend approaching this station then, preparing for it as well as you can?
Okay, so one of the things I would recommend doing is make sure you explain the procedure well. So obviously you're going to explain it before you give it to the patient, and then you've got to give 2 puffs. So I would recommend actually explaining it 3 times, one on each time, because in my experience, I found nurses, they get a bit stressed in the exam, and obviously you're going to forget things under the pressure. So then you've got 3 good opportunities to explain the procedure fully and correctly, which will maximise your ability to pass. And that's it. Always use your marking criteria to practice, as I've said on the other videos, and a timer.
Wonderful. And any final top tips for preparing for this station?
No, not really. Just be aware of what this the space chamber looks like and how to use it. It's quite simple.
And learn that marking criteria. Wonderful. Thank you, Beth. That's really helpful. You've definitely shed a bit more light on this clinical skills station. Really appreciate you joining us, and we'll see you again soon.
Okay, thank you, and good luck with your exam.